Hey guys, welcome back. I have the printout here of the summary of the deep hip rotators, and I just think this is the best way for me to do this because it can get a little spicy when we're learning about deep hip rotators. These muscles traditionally are just going to be rotators. So what we're going to do is kind of go over my notes from when I was in school, and then we'll color it on this page. So feel free to take notes. This is going to be probably a little bit longer video unless I cut it in half, just because we have so much to talk about. So let's just jump into it. We have the first muscle as your piriformis. A lot of people know this muscle because people have common problems with their hip rotators, and everyone blames piriformis because it's the biggest of the muscles, and it kind of looks like pizza. I don't know if that's why they blame it, but we can see here it attaches, or originates rather, I should say, at the anterior surface of the sacrum. So this is the anterior surface. And let's go over to our picture here, and we can draw in our origination as anterior surface of the sacrum. You can see it's also over here as well. So we've done that. The inserts into the greater trochanter on the femur. And we know where that is. It's just right there. On this bottom picture, you can see from the posterior side what it would look like. It looks like it's coming from the anterior and going into the greater trochanter. So pretty easy stuff there. The function is lateral rotation of the hip. Gosh, I'm shaking the table like crazy today. It helps with abduction of a flexed hip. So if you had your hip flexed, meaning your knee was up in the air because it's flexed, you could abduct it with this muscle. Abduct your hip joint, I should say. The structure is it's deep to the glutes. The sciatic nerve exits inferior to the piriformis. So if you look at this piriformis on the posterior side, you actually have your sciatic nerve that travels from here down below, and then it comes out and in between your piriformis and your superior gemellus. So we'll talk about that soon. Let's just make sure we mark on our printout where it attaches. And I don't know how you want to best do that, if you want to color the whole thing or whatnot. This is looking like it's just going over the hip bone. That's not true. The hip bone is covering it. So it's trying to look like it's behind, I think. I don't know. But it doesn't go out in front. So do what you will with that. Let's move on to the next muscle. Okay. This one is the superior gemellus. I say gemellus, you could say gemellus, whatever. But gemellus means little twin. So the origination of the superior gemellus is going to be the ischial spine. Now, if we look posteriorly on this page here, I'm going to grab a different color so we don't get confused. Sorry, that sounded like a weird child. Where was I? Origination on the ischial spine. So that's here on this strange looking bump. Let me draw it over here for you guys on the printout. This bump is kind of hard to see, but you can see where the piriformis is. This is going to be the superior gemellus, and it attaches to that greater trochanter. So it originates on the ischial spine and then goes along and inserts into that greater trochanter. Oh, I don't know if you guys got that, but yes, right there. Piriformis is here. I'll put a P for piriformis. P. I know, it's kind of difficult to see on the camera, but this is your superior gemellus. It's the next muscle down. And like I said, the sciatic nerve actually travels between the piriformis and the superior gemellus. So that's where it would be. Yes, insertion, origin. Let me see here. If you have questions about like the ischial spine and stuff, you can go on to your printouts for the landmarks and you can see where the landmarks are. So if you have questions and you're like, I really want to memorize where this ischial spine is, go ahead and do that. It's on the hip. Function, lateral rotation. You can see it's kind of a small muscle, but it does quite a bit. It helps with abduction of a flexed hip, same situation as the piriformis. I've already told you about the sciatic nerve. Just when people ask that question, which two muscles does the sciatic nerve travel through? You could say piriformis and the superior gemellus. So there you are. Let's move on to the next muscle. This is going to be a different color. I don't have yellow, so I'm going to have to use this burgundy color for some reason. Okay, the next one is your obturator internus. Now I'm going in order here. You have a superior gemellus and an inferior gemellus, but we're going in order of layering. So let's do that. It originates posterior aspect of the obturator foramen. So when we say posterior, we know it's the back side, right? You can see down here, the glutes are covering this side, and you can see through kind of underneath the glutes here. There's that hole in the hips. That hole, that's the obturator foramen. When I like, if I was in class, I'd probably do something really weird where I grab the hip bone and I'm like, obturator, calling like a phone, but we don't use gosh, I don't even remember the word, that anymore. We don't call the operator. We don't do that. So it probably doesn't make sense. Anyway, I don't know what I'm talking about. Where are we? We are on the origination of the obturator internus. So remember, posterior aspect is here. So if we go into the posterior aspect on our, we know that this is anterior up here. Anterior, A for anterior, and P for posterior. So we're on the posterior aspect of the obturator foramen. It kind of covers this hole, actually. It attaches on the inner lining of this hole. And this is going to be your origination, obturator internus. Okay? And it inserts into the greater trochanter, and you can see that as it follows along, right there, as it inserts. And you can do better coloring job than I did. I'm being really hasty. Hasty. I think of Aladdin when I think of that word. Okay, function, lateral rotation of the hip, meaning that you're moving your leg laterally because you're rotating your hip laterally. And it helps with abduction of a flexed hip, the same as the previous two. Okay. Move on to the next muscle. This one is in a green color that I have already used for piriformis, so we shall use yellow, because this is what I pulled out of the bag. Okay, inferior gemellus. We already talked about superior gemellus. Inferior gemellus is going to originate on the ischial tuberosity. Let me see here. So the superior gemellus started on the ischial spine. So same bone in the hip bone is the ischium, but now this is the tuberosity, which tuberosity means city of bumps. So let's look here where we're at. Let's get this printout. We're on the posterior side. This is the superior gemellus. This down here is the inferior gemellus, and it's probably good I picked yellow, huh? So you can kind of see that, hopefully. That's your inferior gemellus, originating at the ischial tuberosity, inserting at the greater trochanter, which we all know is kind of the common attachment for these muscles. Lateral rotation, and it also helps with abduction of a flexed hip. So there we are. You can kind of see a good view of that there. Maybe if I could show you this one. it's by itself here. This is the ischial spine. Going down is the ischial tuberosity, and it attaches over onto that greater trochanter. So there we are. It's kind of backwards on ours because we're using the other side, but there you go. Inferior gemellus. Next is the quadratus femoris. You should have a printout of all of these, and if you do, it might be a good way to memorize these. Sorry, I'm like not on top of getting the right picture for you guys. Sorry, shaking again. Quadratus femoris. Quadratus, four-sided. Femoris, referring to the femur, originates at the ischial tuberosity. Now we know the ischial tuberosity, right? Because we talked about the ischial spine, which is here, this nub, and it runs down, and this whole area through this small area here is going to be your ischial tuberosity. This is the posterior side of your body, so let's remember that. Originates at your ischial tuberosity, inserts a greater trochanter. You can see here, origin is here behind this little bone. Gosh, I can't even remember. It'll come to me. But basically, same kind of thing as the rest of the muscles, lateral rotation of the hip. Let's come over here, and we have it right here. Quadratus femoris. Sorry, if any of these don't make sense to you, just let me know, please. That's your quadratus femoris there. And that would seemingly look like the last of our muscles, but we are still missing, oh my gosh, whoa, earthquake. Just kidding, there's no earthquake. I'm just giving you guys vertigo. You please don't throw up. The next muscle is going to be your obturator externus, because we have the internus, so we need an externus, right? Am I right or am I right? Basically, let me pick the right color here. Lavender. Okay. Obturator externus, it is attaching instead of to the posterior aspect, it attaches to the anterior aspect of the obturator foramen. The obturator foramen is that hole in the hip, right? And you can see this is the anterior side, covers that hole, runs into what? The greater trochanter. We already know that. Let's go to the anterior aspect here on this top picture. Obturator externus. Well, it's an EX. Obturator externus runs through here. So, pretty simple, good knowledge to have about the deep hip rotators. Helps with lateral rotation and abduction of a flexed hip. Important stuff to know, deep hip rotators are commonly referred to as your people sit on it quite often, and it's actually not commonly referred to that at all, but that's something to remember it by. People sit on it quite often. You don't want to remember sits muscles because that's your rotator cuff. This is actually deep hips. So piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, and obturator externus. These are your deep hip rotators. And if you have this sheet, which I hope I sent you, you should be able to review, just so you can remember. So people sit on it quite often. People sit on it quite often. Easy way to remember that. And I'll see you guys in the next video.